the vaccines. This has certainly been the story of the year. And what we're going to ask the Minister is if he will receive this award virtually. And we make the award in honor of all those people that I've mentioned who have been at the forefront of fighting the virus over the past year, as well as to honor those who have lost their lives to this virus. So I trust that the Minister will accept this on their behalf. Thank you. It's good to see you, Minister. Thank you very much. I hand over to you.
Thank you very much, Val, and to all the members of the media. Thank you for this evening. I don't have a lot to say, but just to say that the whole year has been a rather tumultuous year with a lot of work that had to be done. I want to thank the media for all the work that we have done in informing the South African society about the issue around the done everything to help to support our people and save the lives of so many who are affected.
Well, thank you very much. Thank you very much for that, Minister. You know, round and wrap up. Mkhize?
Good evening to everybody. My name is Mkhize, as Val has mentioned. So I will be taking a couple of questions and then affording the Minister the opportunity to respond. For this round, we'll start with 4 questions. The 4-question, Minister, being, how good is our vaccine supply? Where are we getting from? And what can we expect in terms of the numbers and new vaccines? And the applications now in, and if we may expect vaccines from different countries like Russia, and by mid-year, which groups do you expect to have been vaccinated? What is next after essential workers? So I think this one question has 3 questions to it. So I'll take one more if that's okay with you, Minister. The next question, therefore, is how it came about and its impact on dealing with the problem of healthcare and the vaccine rollout. For example, the efficacy of vaccines against the strain, how it has affected brand South Africa, for example, countries bearing entry of South Africans. I'll hand over to you, Minister.
the vaccine supply globally is subject to a lot of forces. Firstly, the rate at which companies are able to produce for the demand of the rest of the world. Secondly, that some of the major powers have put a lot of resources to secure a lot of vaccines ahead of some of the low and middle income countries such as South Africa. So that will affect the way we receive the vaccines. So we have ordered mainly 2 vaccines that we at this point have ordered from Johnson & Johnson, where President has confirmed we have had 11 million which are going to be available. Just about 3 million will start in April to June, and then about 4.1 for the remainder of the 2 quarters. We have also ordered additional amounts, but they're still under a lot of discussion, so it's not been confirmed from J&J. So we are not in a position to talk about it until that is confirmed. The second, of course, we have between now and the end of March, we're expecting about 500,000 of the vaccines, vaccines from J&J. Secondly, we've also ordered from Pfizer. We are waiting to confirm details of the order, but our anticipation was that the first amount of what 600 and say about 600,000 will arrive here before the end of March, and then more will arrive. Between 5 and 7 million should arrive in April to June, and then after that we should get more. Again, with Pfizer, we need to sign the first agreement and then confirm the second agreement. So that is what we are looking at between the 2. But Pfizer would order 20 million. Then COVAX has indicated that they will be giving some of their vaccines already. So the 100,000 will come with the first batch. So when we say 600,000, it will be 500 that we had ordered, and then another 100,000 that would have come from COVAX. We have not ordered any others. In the meantime, we're going through a lot of discussion about getting other vaccines. So we are, for example, trying to finalize the issue with Moderna, which has made some offers. We're also discussing with Sputnik, the Russian vaccine, and that vaccine is going through the process of registration. And out of that, we hope that we'll get some, but we have not got anything confirmed. Sinopharm and Sinovac have also been a discussion that is going on those. So once those are finalized, we can talk about them. So those are the groups that we're discussing with at the moment. And then the question of efficacy with J&J is the one that's been demonstrated to have the most effective action against the variant that is found in South Africa. The others, such as Pfizer and Moderna and them, they've also demonstrated some degree of activity. However, that was demonstrated in a laboratory setting. It's not been demonstrated in a clinical trial. So in the process, all of these are some of the considerations that we take into account as we go through the selection of the vaccines. It has affected the advent of the variant has affected South Africa. There are many countries which have become quite nervous, and in the process, they have issued bans, travel bans against South Africa. But we hope that when the vaccination process is over, it will be possible to actually get some of those travel bans reversed, because from point of view of Johnson & Johnson, it should be very clear that it has actually shown efficacy even against our current variant. So as soon as all of the scientific findings are made known to everyone, they will understand that there's no need to worry about South Africa, because we would have been able to contain it. The real issue with the variant is that it has spread to quite a number of countries. Last we checked, the variants have been found in almost 48 countries. Some of them are a bit different. However, the one that has been identified in South Africa, 501V2, we have at least concrete evidence that the Johnson & Johnson vaccine is fairly strongly effective against it. And then, of course, Pfizer vaccine is also similarly strong, although there's a slightly different strength of its activity. but it is actually useful. So all I can assure South Africans about is that the 2 vaccines are actually the best we have to be able to deal with the vaccine. Thank you very much. Sorry, to deal with the variant, sorry. Thank you very much.
Thank you, Minister, for that clarity. Moving on to the next set of questions, I will pose the 2 that were raised by Lali van Zeitman. She is a freelance journalist. Her first question being that, what are the lessons learned over the past year in terms of the public understanding of health and science? Follow on to that, she says, how can we better educate people in the future? Her last question is, what is your impression of the level of science and health education reporting amongst the journalists? The following question was raised by Sizwe Dlamini. I'm not sure where he's from, but his question is, did the Solidarity Fund donate PPEs to the government, or was the government expected to procure it? As some of us were of the impression that the Solidarity Fund would donate the PPEs. The last question, Minister, is from Vuyo, and he says, good evening, Minister. What is the current status of the AstraZeneca vaccine? What has been decided in terms of how many will be distributed via the AU facility, and how many will be used here? In what sense? That's the end of the questions.
Sorry. The question was about what lessons have been learned for the public understanding of the science and health. The last year has shown a huge amount of interest amongst the general public on details of science and the health issues, how the pandemics work and how they are caused, and what the viral infection, how the viral infection spread, and also what needs to be done from the point of view of the public health policy to contain those viral infection. All of these issues have shown a lot of interest. We've actually had scientists debating and presenting very detailed scientific work, which has actually sustained a huge amount of the public interest. What we found was interesting for us is that people were able to follow what the scientists is taken, why it was taken in that way. I think that's a healthy way of how we would deal with issues of public health, as well as issues of dealing with the pandemic. So because of all of that, we believe that it is important that we must continue to sustain that level of understanding, because in the first instance, for public health, from a public health perspective, the person who has to take responsibility and take charge of their own, health status is the individual, based on good information, knowing what practices to embark upon to be able to do everything that will help them to stay healthy. It's only when they are not able to manage their own situation, when the disease or infection gets more severe, that they need assistance. So the primary health care is about. So I think it's a very, it's been a very educational process throughout the whole of last year. But also with the journalists, I've found that most of the time they did a lot of research, they followed the debate, and they also spent time to understand what the science behind it all was, and they've actually fairly reported on the pandemic from the point of view of the science behind it, the outcomes of various researches, and also going all out to look at what's going on in other countries. So they have actually done quite a great job in keeping the public informed. The Solidarity Fund, yes, did donate the PPEs. The amount of money that was put in the Solidarity Fund was used to buy a number of items of PPEs which were subsequently handed over to the department and distributed in various provinces. So, the amount of PPEs that we've got was a combination of what the department bought from its own budget, as well as what it can come from those donations. The Solidarity Fund didn't just deal with donation with PPEs, but they also assisted to fund ventilators. They also assisted to fund some programs of community awareness supporting NGOs. So there has been quite a lot, and also buying diagnostic kits when we needed to buy some of these during the time when it was difficult. So they actually played quite a role in that regard. So there has been quite a lot of assistance that came from those donations, and we really appreciate it. Then the current status of the AstraZeneca vaccine, we had ordered 1.5 million vaccines, and we took possession of the first 1 million. When we discovered that there was a challenge that needed to be re-looked at in relation to AstraZeneca, we then felt it was important to as to what exact researches we need to be doing on that. In the meantime, we've offered this to the African Union platform. So 1 million is going to be going to the African Union platform. All of the discussions have happened. The African Union will buy it at the same cost at which we bought it from Serum Institute. And in the process, what we're expecting that the legal teams must of 100 people that are testing, how many are testing positive? And all of those during the peak, that's gone much lower down now. So as a result of that, we have to continue with the containment measures, the use of, we would remain vigilant to resurgence is coming. In the process, we need to accurate when the next surge is coming. It may well come, particularly when you've got huge movement of people during the public meetings or during Easter weekends, during the the Easter holidays, when people are moving up and down. That might have an impact as well. But we will be observing to see what is happening at that time. The compromise in this whole situation is that we need to insist on the use of mask sanitation, sanitizers rather, and distancing, so that it can further delay the rapid, if we are able to, keep to the distancing, because we think that the reduction in the numbers in the last set using mask, the next that we probably might end up with another way later that might happen. But it also depends on how we as a society behave. Thank you.
The next question says, how many frontline workers have been vaccinated in the country so far? And regarding the Russian vaccine, how much has the government spent on it? Has the Russian vaccine been tested and checked for the expiry date? And then the next question from Zwelini says, when do we expect to achieve herd immunity